Celestine Palmer is 82 years old, among the highest risk group for COVID-19. After weeks of confusion, it was her church group that told her where and how she could get the vaccine.
We have to tell more people where to go and, how easy it is to get it. So I think that's the problem. They just don't know where to go. It's not publicized the way I think it should be.
The lack of access to resources is also leaving underprivileged communities behind.
If you live in this neighborhood or around here, you ain't getting that shot. Look at the line. Do you see anybody that looks like they could possibly be from the neighborhood in this line? Very few. I'm a degreed engineer, right? And it wasn't easy for me to get online and get it done. If you don't have access and you don't have skills and you don't have capability, you ain't got no chance.
The Los Angeles Times has recently exposed a California program providing special access codes for vaccine appointments to people in hard-hit communities was being misused by outsiders, with electronic appointments circulating among affluent, mainly white and low-risk groups. One of the causes for places like this to do away with the appointment system. This is one of the rare vaccination centers that accepts walk-up registrations, and that's why thousands of essential workers and the elderly who haven't been able to make appointments elsewhere are flocking to this particular site, and some have to wait for several hours in line. But they say finally getting immunized against COVID-19 is well worth the wait.
Moderna second dose.
By mid-March, nearly 11 million vaccine doses have been administered in California. About a third of the recipients are white, while only about 19% Latino and 3% Black.
The next thing was where the vaccines across America went wasn't necessarily where the hotbeds of COVID infection were. And that was a big challenge because that means maybe wealthier people, other zip codes, other skin colors got access to the vaccine before poor or Black and brown Americans got it. And that's an equity gap that needs to be addressed.
Soon after a visit to this vaccination site, California's Governor Gavin Newsom recognized the disparities in the vaccination rates among minorities.
The issue of equity.
Earlier this month, the state announced it would begin sending 40% of all vaccine doses to the most vulnerable communities and provide additional outreach programs.
We'll reach people who don't maybe have transportation, who may not have the finances to ride public transportation. So we'll go out to them and to make sure that they're vaccinated.
Communities disproportionately impacted by this pandemic have been left behind in vaccinations, but delayed immunization in most vulnerable communities could also mean a delay in ending the pandemic. It is Tianshan, CGTN, Los Angeles.